And so from the Alisa Hotel in Accra, this is a stakeholder forum on investment in sanitation and waste management. Thank you very much indeed. Gathered here are friends from academia, parliament, government agencies, the private sector and development partners to delve into a very important report that looks at the economic benefits of investing in sanitation and waste management. My name is Bernard Avle, a radio and television journalist with ChannelOne Television, and we are carrying live this all-important program. We welcome our viewers online to join the discussion with comments on the numbers we'll be putting on the screens. This is meant to be an interactive platform to cross-fertilize ideas on a very critical sector at a very important time for Ghana. We thank our friends who have joined us from the various departments, ministries, and agencies in government, and we look forward to your contributions to this program. This program is being organized with 4 arrowheads. The University of Ghana's Institute of Statistical, Social, and Economic Research, ISE, are the lead researchers, and we want to acknowledge them with a round of applause. And they did the research through a very important project called the EFD, which is a very critical project which looks at environment. So we thank the EFD for their support as well. Before we introduce some of our key functionaries, we'd like to invite Dr. Evans Otieku to give us the opening prayer, and then we delve into the substantive issues. Please welcome Dr. Evans Otieku with a round of applause.
Shall we pray? Everlasting Father, we thank you for the opportunity to gather here, the opportunity to learn, to discuss, and also to act on what we are about to hear. It is our prayer that our invited guests who are here to join us, you grant them travel mercies. It is also our prayer that a team of scientists, our moderators, our dignitaries, who have gathered here today to grace this occasion. Jehovah Lord, you be with us. For the rest of the program, we ask that you chair it, and at the end, honor and adoration shall be yours. For this we ask in the name of our Lord, the Father, Jesus Christ. Amen.
So a big thank you to Dr. Otieku. Yes, of course. We'd like to acknowledge a number of stakeholder groups present here. As we said, this discussion is based on a study put together by the ISE titled An Economic Analysis of the Benefits of Adequate Investment in Waste Management and Sanitation in Ghana. We are very happy to say that we have at least 5 parliamentary subcommittees represented here. So we have the Committee on Local Government. If the members are here, they can give us a wave, so we acknowledge them. Put your hands together. We also have the Committee on Environment. Is that the name of the committee? Yes, a round of applause for them. The Committee on Sanitation, I believe. Is the same committee? Sanitation and Water Resources. Can we see the members, please? We also have the Committee on Health. The Committee on Health. And last but not least, the Committee on Finance. Any finance committee member here? Not yet. We're also happy to have some of our leading waste management companies. And I'd like to ask them to give us a wave from where they are sitting. I can see the MD of Jacora Ventures and other waste management companies. Please give us a wave where you are. Thank you very much for joining the program. We also have some civil society groups and NGOs and associations, including the Environmental Service Providers Association, the ESPA. Where are they? Thank you very much, ESPA. And also CONIWAS. CONIWAS. Where are the CONIWAS people? Wonderful. Please put your hands together for all our invited friends. To put into context the study before we get into the details, I'd like to invite a man who used to be my lecturer and whose course I excelled at, Professor Festus Ebo Turkson, is with the ISE, and he will put into context for us with some brief opening remarks today's program. Please welcome Professor Ebo Turkson with a round of applause.
Good morning, and thank you, Bernard. I'm from the Economics Department, University of Ghana, yeah. But I work with ISA as well, right? So distinguished members of Parliament, representatives from government ministries and agencies, MMDAs, development partners, the private sector, civil society, the media, and our colleagues from academia. I warmly welcome you to this stakeholder engagement on waste management and sanitation in Ghana. We have convened here today around a very important study by researchers from the University of Ghana, which evaluates the benefits of adequate investment in waste management and sanitation in Ghana by examining the state of waste management and sanitation and their wider economic, social, environmental implications. The study reminds us that waste and sanitation are not simply technical or environmental matters, but fundamental development issues that affect public health, environmental sustainability, productivity, livelihoods, and the dignity and well-being of Ghanaians. It is important, therefore, that Ghana prioritizes investments in waste management and sanitation as the benefits outweigh the cost in multiple folds. The purpose of this engagement is threefold. One, to present and clarify the key findings and recommendations from our study. Secondly, to listen to your experiences and perspectives from policy, practice, community engagement through the panel discussion that will take place. And then thirdly, to identify concrete areas where evidence from this research can inform policy, it can inform investment decisions, and operational improvements on waste and sanitation management at both the national and local levels. We wish to encourage all participants to engage actively, and frankly, your insights, whether from the legislature, central government, local authorities, private sector, informal sector actors, NGOs, community organizations, or development partners, are critical if we are to move from analysis to action and to build a more coordinated, inclusive, and sustainable approach to waste and sanitation management in Ghana. On behalf of the lead researcher and my colleagues from the University of Ghana, let me express our appreciation to all of you for making time to be here. We look forward to leveraging your expertise to bear on this vital national conversation. As researchers, we are confident that the deliberations today will help us to take practical steps towards building cleaner cities and communities, stronger institutions, and a better quality of life for all Ghanaians. Once again, you are all welcome. As the Ghans would say, Obake. Thank you.
Thank you very much, Professor Ebo Turkson of the University of Ghana Economics Department. Please put your hands together one more time for him. So this is an important stakeholder conversation on an economic analysis of the benefits of adequate investment in waste management and sanitation. It's meant to be interactive, it's meant to be discussive. Please feel free to join the conversation if you are watching us online with your own comments ahead of the presentation and during the presentation. I'd like to acknowledge a few key members of Parliament. I don't have the full list, but if I mention your name or if it sounds like your name, please forgive if I make a mistake. We have, for example, the MP for Lambusi and member of the Health Committee, Honorable Professor Titus Bayu. Please put your hands together for him. Thank you, sir. He's also the board chairman of Kolebu Hospital, for those of you who care to know. We have the MP for Wa East, the Honorable Dr. Godfred Seidu Jesau. He is from a number of committees, both the Environment, and also the Agric Committee. I think you chair the Agric Committee, right? Let's acknowledge a round of applause. Thank you, sir. And Cocoa Affairs. It was hot last week. The MP for Salaga South, Honorable Zuwera Mohammed Ibrahim. A round of applause for her, please. I'm not sure of the committee, but I suspect environment, science, sanitation is also there. Wonderful. We also have the Honorable Sanjananja Atebubu Amantin. He's here with us. Honorable Haruna Seidu. Haruna Seidu. Your constituency has escaped me. Wenchi in the Bono region. Buzias Wenchi. Haruna has taken it with 10 fingers and 10 toes. They've written Kletuseidu Dabila, but I think it's Dapila. Yes, it's not Dabila. I know him, some Upper West somewhere. So they miswrote your name, but I know you. So Kletuseidu Dapila, thank you very much indeed. It's good to see you. We have a strong contingent of MPs. I'll do the rest of the introductions later. I'd like to also introduce the immediate past director of ISE, Professor Peter Korte, who's here with us. Just acknowledge his presence. And the newly minted member of the President's Advisory Group on Economy, our own Professor Priscilla Chumisi Bafo. And a big contingent of the academics from ISE, all the ISE professors, please rise so we acknowledge you, all the ISE lecturers who are here. That includes Dr. Kwame Ajay-Mante and Dr. Evans Otieku. The rest of your names I'll bring to us. So as I said, the program is divided into two broad parts. In part one, the investigative team who did the research will come and take us through the research report and give us the highlights. When they are done, we'll open the floor and take questions around the content of the report. We'll then take a short break after that and do a panel discussion involving some critical stakeholders, including members of parliament, the private sector, academia, and other civil society groups. So that's broadly the plan for today. I'd like to now bring up stage to take us into the research, the principal team that did the research, Professor Peter Korte, who's the immediate past director of ISE. He's the principal investigator. He will later be supported by Dr. Kwame Ajay-Mante. Let's welcome Professor Peter Korte with a round of applause.
Thank you very much, honorable members of parliament, distinguished guests, and friends of the media. I don't know why they always say friends of the media, but they are friends, so we need to acknowledge them. Let me stand on the existing protocol ably established by my colleague, Professor Turkson, to say good morning to you all. Oh, I didn't get your response. Yes. Your constituents will have to see you smiling, say that our MPs are happy, our friends are happy. Thank you. Yeah, so we are quite excited this morning. I'm grateful that you all made time to join us. At ISE, I think we are noted for economic issues, state of Ghanaian economy, and all the key things around the economy, social development, etc. We also do a lot of work on the environment. So there is a unit, a research unit called Environment for Development, funded by the Swedish. And every year we get close to, my co-director is here as well, Professor, look, I'm forgetting your name. Wisdom Apalu is here. Each year we get $100,000 plus to undertake research on environment, natural resources, fisheries, and so on and so forth. In fact, he is the board chair for the Fisheries Commission as well. So it tells you that we are very much also into issues of the environment, etc. So as part of that, we are doing this work on sanitation and investment. Now, we have seen sanitation, waste management, oftentimes as a social obligation, not as an investment. And that is the message we want to drive, that let's not look at it as a residual. When we have financed every unit, or the key ministries, what we term as key ministries, then the leftover funds we give to sanitation, waste management. That shouldn't be the case. In fact, sanitation, waste management should be seen as an investment. If you invest in waste and sanitation, health issues would not be there, cholera outbreak, and all the things we find will not be there. If you don't, then the consequences are there. If you invest, there are a lot of benefits that will come to you. So that is the key message we want to drive today. Our researchers, other researchers are all here. I think they've been acknowledged as well. And this is how we outline our presentation, introduction methodology, our key findings, and then we provide conclusions. Waste and sanitation management is quite an important part of us. Important waste management and pollution, air, soil is key. When we do that, the ecosystem especially contributes to greenhouse and many other challenges. The situation also brings health outcomes, health challenges if it's not properly undertaken. So we need to critically look at waste and sanitation and ensure that they are properly managed. Several studies have shown that when you invest in waste and sanitation, you are likely to gain a lot. A World Bank study, for instance, estimates that if you invest very much in waste and sanitation, you're likely to derive benefits. And annually, you're likely to have about $290 million annually through premature death. That is a consequence of not investing in proper waste and sanitation. A single cholera outbreak in Ghana cost for the low-end, low incidence areas $62, and for the high incidence areas about $107 per person, per household. And the potential direct cost of saving from an episode amounted to almost $100,000 in low incidence to about over 800 in high incidence areas. So it is critical that we invest in waste and sanitation to avoid the challenges. And it's not peculiar to us. If you look at sub-Saharan Africa, for example, you look at Nigeria, it loses on a conservative estimate of about $3 billion annually due to poor sanitation management. And that corresponds to about 1.3% of GDP. This is quite huge if we are losing this much for improper waste and sanitation management. It is also established that annual waste generated in Ghana was equivalent to $4.6 million, equivalent to 0.3 kilograms per capita daily. A World Bank study, which is quite interesting when we came across it, that if you invest $1 in proper waste and sanitation management, you are going to get $5.5. So it's even multiples of that. And we have rather treated this sector as a residual. We are not giving it the importance it deserves. And I think that is where we are coming from. So our point or argument is that waste and sanitation initiatives are often regarded as residual expenditures, vulnerable to budget cuts. So anytime there's a budget cut, you look around and say, oh, let's cut the waste and sanitation. Let's look at health. Let's look at other economic sectors. And that, we think, is not good enough. Rather, if you view this as a high-yielding investment, that will generate a lot of great potential. So our study objectives were, as outlined there, to look at proper waste and sanitation management, developed an investment prioritization model to show you clearly how, if we prioritize our investment in waste management, the MMDAs and all the different segments of the economy are going to benefit, and we support this with figures, as you see. Also, if we invest, how that is going to improve bring benefits to health, to environment, ensure environmental sustainability, and by extension, economic growth. If you have a strong workforce, you have a healthy workforce, you are likely to grow. If you invest in health, you invest in other sectors, we are all likely to grow rather than spending that money trying to fight cholera, trying to fight diseases, and so on and so forth. And we would also, apart from this presentation, have a report that will be shared. We have policy briefs that will be shared. We're going to continue this dialogue. We don't think we should end here. So I'm happy you're all here. After this, we'll continue to engage to ensure that we prioritize waste and sanitation management. Our study was quite comprehensive. We didn't just do a desk study. We used a mixed method. So we used secondary data, relied on secondary data. For some of you, we came to your offices, we collected data to analyze Ministry of Health, local government. We really came around, and we also went to 5 regions. If I could mention them, we were in Accra, we went to Kumasi, we went to Sekondi Takoradi, we went to Tamale, and we expanded our scope as well, apart from the regional capitals. In some cases, we went to Ashiaman, we went to Tema. And then we also broadened our sampling to include slums, Nima and other slum areas. We went to all of those places, spoke to them, spoke to operators, etc., to ensure that we are able to capture views. This presentation will not give you all, but in the report, we will see, what people think, the Boboya operators and all the agencies that are involved, what the issues are, and the need to really promote proper waste and sanitation management. I would invite my colleague. We are told to mentor younger ones as we are growing, so I'll invite him to present the key findings as well. Then we can all have a discussion. So this is Dr. J. Mante, who is our environmental or natural resource economist. Thank you.
Good morning, ladies and gentlemen. Thank you very much, Prof. And I would like to also rely on the existing protocol that has been established and just proceed with the key findings from our study. So we sought out to first quantify the economic and social costs that are associated with poor waste management and poor sanitation in Ghana. Now, before I get into that, it's important for us to understand where we are at the moment. So at the moment, for the year 2025, for example, we invested, when I say we, I mean Ghana, allocated a total of about 180 million Ghana cedis to waste management and sanitation. Now, these were shared obviously across the MMDAs in the country. Metropolitan areas were allocating on average 2 million Ghana cedis to waste management and sanitation. Municipal areas were doing on average 690 million Ghana cedis, and then districts were doing on average 307 million Ghana cedis. Now, these amounts that had been allocated translates into about 10 cedis per capita for the whole year in metropolitan areas, about 5 cedis per capita in municipal areas, and about 3 cedis 50 pesos per capita in the districts. Now, what did we do? We took 5 key disease conditions that are associated with poor sanitation and poor waste management. These are malaria, cholera, pneumonia, typhoid fever, and diarrhea. And then we sought out to look for a number of things. Number one, we looked at how many days are lost by people who have suffered from these disease conditions, what we call the lost days. Now, these are days lost because people do not go to work or they cannot go to school because they are suffering from these disease conditions. So we examined lost days. Then we examined mortality. How many deaths are recorded that are linked to these 5 disease conditions? Then we, of course, looked at the DALYs, which is disability adjusted life years. How many years have been lost due to premature deaths, people who have died prematurely? They did not attain our life expectancy age because they suffered any of these disease conditions. And then also we did look at the direct medical costs involved in treating episodes of any of these disease conditions. And then we also did the indirect costs or productivity losses that arise as a result of people suffering from these disease conditions. Now, when it comes to the direct medical costs, this is what we did. So we had data over a range of a lower bound to an upper bound of how much it costs to treat a single episode of, say, malaria, how much it costs to treat a single episode of cholera, pneumonia, typhoid fever, and diarrhea. Because it's over a range, we were working with, the midpoint of the range. We don't go to the extreme or extreme high or extreme low end. Now, we found that for malaria, for example, it costs 450 cedis to treat a single episode of malaria on average, 620 cedis for cholera, 1,848 cedis for pneumonia, 475 cedis for typhoid fever, and 55 cedis for diarrhea. And so for all the episodes of malaria, cholera, pneumonia, typhoid fever, and diarrhea that are recorded in a single year, we quantify how much is spent in direct medical costs. Now, these are costs that are borne by households and by the government, of course, because government have to make payments to the NHIS. Now, these costs came to a total of 5.6 billion Ghana cedis in a year. So these are direct costs associated with these disease conditions which are related to sanitation and poor waste management. On productivity losses or indirect costs, we use the human capital approach, where we estimate the value people bring on the table, okay, and therefore the productivity loss could be equated to the productivity or the value that is lost because these people were not at work or at school. Now, to examine the value people bring to the table, one way to do it is to look at what do they get at the end of the day when they come to the table. So that is wages and salaries. I have to say that for the purpose of this exercise, we relied on the national daily minimum wage, which is about 20 Ghana cedis. Now, you would all agree with me that there are many people who earn more than the national daily minimum wage. And therefore, using the national daily minimum wage in this exercise means that this is a really, really conservative estimate that we have put out here. And the cost could way exceed that. Now, what we do is that we examine the length of days for each episode, length of days lost or length of hospital stays for each episode of each of these disease conditions. So, for example, if someone has malaria, they are likely to be out for between 1 to 5 days. Now, these are all epidemiological data that we have sourced and we are using for this analysis. And again, we go for the averages, the midpoint. Okay. So for malaria, lost days per episode is 3 days. For cholera, 3.5 days. For pneumonia, 9 days. Typhoid fever, 4 days. Diarrhea, 4 days. What it means is that if someone is out or someone is sick, suffering from cholera, they are likely to be away from work for between 3 to 4 days. Now, for each of these days that we are losing their productivity, we have quantified it by looking at they earning the minimum wage of 20 cedis per day. And therefore, if they earn, say, 1,000 cedis or 2,000 cedis, it could even be more. Okay, all right. Now, for the indirect cost, the total for these 5 disease conditions came to 650 million Ghana cedis. So in all, direct and indirect costs of suffering any of these 5 disease conditions came to 6.2 billion Ghana cedis. Now, other things that we lose, for example, mortality, about 107,000 people are dying because of these 5 disease conditions, and the DALYs is more than 3.8 million. So 3.8 million years are being lost, okay, by people who are suffering these conditions because they died prematurely or they spent time away by living with these conditions. And then, of course, the lost days, nearly 32 million lost days when we put together all the episodes that can be suffered by people. So that's the first part. That's our quantification of that. Number 2, we sought to look at the social and economic implications of poor waste management, or conversely, if we would invest more. 4 key findings came out. Number 1, many of our respondents were We had metropolitan and municipal environmental health officers in there. We had operators in there. We had people who, aboboya or informal service operators, and the people who patronize their activities, of course. Number one, they largely agree that there is an adverse effect of poor waste management on public health. Number two, they agree and acknowledge that poor waste management leads to absenteeism, skipping work, being late to work, and for those in the public and shared spaces, like the market centers, we were there, like the lorry stations, we were there in this research, they said they lose businesses, okay, during these times. Well, many of the informal operators, particularly or specifically aboboya operators, did not seem to quite agree or perceive that there are any health implications associated with the work they do in the manner that they do it. However, every one of them did believe that there are employment opportunities that could arise if we would invest more in sanitation and waste management. Thirdly, we sought to develop or make, do an investment prioritization framework. What should we prioritize, okay, in that sense? And we did this using two approaches. First of all, we had what we call the business as usual case. So this is where we don't change anything and we do what we are doing at the moment, i.e. we spend our 180 million Ghana cedis every year on sanitation, and then we looked at what we call the best case scenario, which I will explain in a bit. Now, what we did was to examine the potential gains in either scenario and then compare them. So in the first case, which is the business as usual scenario, the government of Ghana maintains its 180 million annual investment into sanitation and waste management. Now, because we are generating about 4.6 million tons of waste every year, this 180 million translates into a spending or an average spending of 38 cedis per ton of waste generated. Okay. Now, if we break that down, metropolitan areas are spending about 64 cedis per ton of waste, municipal areas about 40 cedis, and about 32 cedis in districts. Now, the other case is what we call the best case scenario. Now, what we did in the best case scenario is to let investments align with the average standards expected of lower middle income countries, which Ghana is. Again, these average standards of investment into waste management in lower middle income countries are over a range. Okay, so there's a lower bound and an upper bound. Again, sticking with being consistent with what we've done over the course of the study, we go for the midpoint. So we are not even going to the extremely high values, and obviously we are not staying with the too low values. Now, best case scenario or best case expectation on average for lower middle income countries is an investment of 1,519 Ghana cedis per ton of waste to manage a ton of waste in metropolitan areas. 957 Ghana cedis to manage a ton of waste in municipal areas, and 769 Ghana cedis to manage a ton of waste in districts. Now, if we average this at the national level, weight a few things, this comes to about 1,080 Ghana cedis at the national level as the best case scenario. This is how much we should be investing per ton of waste generated, as opposed to 38 cedis per ton of waste, which we are currently investing. I think that you can make the conclusion from here. Now, we proceeded to look at what is the returns to the investments that we are making in waste management and sanitation. What are we getting back? Again, we did this for the business as usual scenario, and then we did this for the best case scenario. Okay. Now, in the business as usual scenario, for every 1 cedi that we invest in waste management, the returns is about 180 Ghana cedis at the national level. Of course, the returns differ across areas, about 99 cedis for metropolitan areas, about 202 cedis for municipal areas, and about 290 cedis for districts. But then at the national level, that comes to 180 cedis. Now, in the best case scenario, if we invested 1,080 cedis per ton of waste generated, then the returns is going to rise to about 556 Ghana cedis nationally. Again, at the metro areas, it's about 390 cedis. At the municipal areas, it's about 444 cedis, and then at the district area, it's about 590 cedis. So when we average that and do a little bit of weighting in there, that comes to about 556 Ghana cedis for every 1 cedi that we invest in waste management if we did the best case scenario. If we maintain with the business as usual, we are only earning 180 cedis per cedi invested. Now, where are these gains coming from? The increase in the returns, where are the increases coming from? Now, the key drivers of the increases in the case of the best case scenario is reduction in sanitation-related morbidity. If we are able to invest as much as 1,080 cedis per ton of waste generated, we are almost wiping away sanitation-related disease conditions. That drops by more than 97% in our modeling and analysis. The attributable mortality also drops by about 81%, and then the DALIs also drop by nearly 90%. So these are the key drivers that are yielding the returns from every 1 cedi that we will invest in sanitation and waste management. Okay, so essentially what we are saying is that in the business as usual scenario, yes, we are investing some money, all right, at the moment. That yields us returns of about 180 cedis. If we did what we should do and clear a lot of the waste that we generate, or perhaps nearly all the waste that we generate, then our benefits is going to rise to about 556 nationally. Now, the last thing I'll talk about before we make some conclusions and recommendations is that we also estimated what the total benefits per year is to the country under the 2 different scenarios. Certainly, as long as you are making some investment, there will be some returns. So certainly, even under the business as usual scenario, we have some returns. You are making some benefits. Okay, and we did our modeling for a period of 8 years from 2025 to 2032, applied a discounting factor, and then we computed what the total benefits would be. And these are the benefits that are arising from the medical costs that we don't have to pay. These are the benefits that are arising from the productivity losses that don't happen. These are the benefits that are arising from all the things that I've already spoken about. Now, in 2025, the benefits that we are getting from in the business as usual scenario is we are making benefits of about 6.8 billion Ghana cedis. And this could rise to about 8 billion Ghana cedis by 2032 if the government of Ghana commits to 100% funding of the current waste budget. However, if we did the best case scenario, the multiplier effect is huge. The total benefits, if we had invested 1,080 cedis per ton of waste in 2025, the total benefits that would accrue to us would be about 58 billion Ghana cedis. And this could rise to about 67.2 billion Ghana cedis by 2032, which is what the last year that we modeled up to. So, in conclusion, I think that the results do show, without doubt, that Ghana spends relatively modest amounts in investing in sanitation and waste management compared to the economic and the economic losses, productivity losses, the costs involved when we look at it. Preventable diseases linked to poor waste management, the malaria, the cholera, the pneumonia, the typhoid fever, and the diarrhea, which we studied, are giving us close to 32 million lost days in a year. 177,000 deaths attributable to these 5 disease conditions in a year, and of course, 6.2 billion in losses, both direct and indirect losses. And our qualitative exercise on the field confirmed some of these things, or all of our findings. We find households and our respondents confirming that erratic waste collection, poor waste management, and so on contribute to sick days, it contributes to them missing work, or they go but they are not working, so presenteeism, absenteeism, loss of productivity, and so on. And so we have a number of recommendations, but I'll highlight just 3. I think the obvious recommendation then we want to make as a research team and as ESA is that there has to be substantial increment in investment in sanitation and waste management. But we want to immediately add that whenever we are making the case for the increment, we need to include the health co-benefits to make a justification for increased investment, rather than just look at what we are budgeting and thinking, okay, we don't have the waste, or as my senior colleague said, we are just dealing with a social issue. There are health co-benefits, and if you could quantify them correctly, then we could make a case for the increased investment in sanitation and waste management. We want to recommend a focus on high-risk areas like urban slums, the flood-prone areas, to reduce issues of pneumonia, cholera, and so on, and the mortality associated with them. And also, we want to recommend support for MMDAs to prioritize the hotspots in peri-urban areas within their jurisdictions. The last recommendation we want to make is that we want to recommend support to strengthen the capacity of MMDAs to improve or enhance their data systems and their planning and their budgeting. We would love to see MMDA's budget for waste and sanitation, having done some of the work that we have done, putting in some numbers. What are the health returns? What are we losing if we do not invest? And then that kind of exercise would then inform the budgeting for sanitation and waste management. And we think that some support given to strengthen this capacity of MMDAs to do this would be very crucial, and it would go a long way to improve the situation in Ghana. So thank you very much for your attention.
Wow. I think he deserves another round of applause. So that was Dr. Kwame Ajay-Mante. Earlier on, you heard Professor Peter Korte. This is a stakeholder forum on analysis of the benefits of investments in waste management and sanitation. We're live on ChannelOne television and live online. We're here at Alisa Hotel before an audience of very key stakeholders, including legislators, members of government, private sector players, civil society, and development partners. I'd like to acknowledge a few more people I missed in the first round before we open the floor for some general questions. Professor Wisdom Akpalu is the director of EFD. Please put your hands together for Professor Akpalu. As I mentioned, it's a project that they run with ISE, a very important project in environment. Professor Nukpeza is from the Institute of Environment at the University of Ghana. Professor Nukpeza, thank you for being here. I think I miss Honorable Yao Frimpong Ado, Chairman of the Environment Select Committee. Honorable Frimpong Ado, please, are you here? It's good to see you, sir. There are quite a number of MPs as well, whose names I don't have. If you're an MP that I've not mentioned your name, please give me a wave. Oh, I will do the correction. You know, these days you are 276, so it's a lot. It's very confusing. When you were 175, I knew all of you. All right. I'd like to also do a few more acknowledgements. But before that, let's open the floor. Ben, please get a couple of mics for us. Right. I have two questions. Can I start with my questions? Very good. So, Prof, you have construed sanitation and waste management not just as environment, but it's economics, it's social, it's health. Beautiful. When you were calculating the investment into the sector, did you just look at one ministry, department, or agency's allocation, or did you sort of pool? Because, for example, if you go to public health, there's community health. They do certain things which have to do with environment. So every now and again, people from Adabaka Polyclinic will come on CTFM and say they are doing some cholera education. Now, the budget for that will not come under local government. It will not come under environment. It may come under health. All right? So my question is, how did you arrive at the population of resources for health in your analysis? Did you use a sectoral approach, or did you scavenge around the various budgets to pool the various monies? Because you are telling us that sanitation and environment and waste management is not restricted to just that sector. There's health and other things. So that's question one. And question two is the scenarios you presented, the best case and worst case. It seems to me as if it still contemplates government as the only investor. Okay? If you're talking about sanitation and waste management as an investment, did you contemplate a scenario that would include a private investment? If you did, will you have the same benefits? Because I noticed you did ton per whatever, CD per whatever. Did you look at investment from, say, a bank? When you talk about investment, and if a private sector person comes into an investment in sanitation waste management, will the way you calculate the benefit be the same as you did? Because the way you did the calculation it looks to me as if you are doing this from a government as a social investment. All right, these are my questions. You don't have to answer it now, but these are my questions. So now let's open the floor. Where are the mics? Good. Your Friend is the chair of the Committee on Environment. Please send your mic to him. He will ask the first substantive question.
Yeah, thank you so much. And Prof and his team, thanks so much for this wonderful job. I mean, everybody in this room acknowledges that. This is very comprehensive. However, I have just one issue here. In dealing with the cost-benefit analysis of sanitation, I thought you would distinguish between the formal sector of the Ghanaian economy and the sector. In fact, we have a large informal sector that is about 80% of the working population. And this informal sector, when you look at the income levels, the income levels are so low. At times, people just give as and when somebody performs any function or duty. So in doing your calculation, I wonder how you got those figures. Because I looked at closely at the sectors and the figures. I realized that most of the figures came from the formal sector. And when you base your analysis on just that, you are going to get it all wrong. It's even worse than you have presented here. It's even worse.
So you're saying the money is lower than the even presented?
Exactly.
Oh, okay.
Yes, exactly. It is much
it's much lower.
Yes, if they covered the informal sector. Because when these informal sector workers, if you go to where they live, it's mostly low income areas, the slum areas, you mentioned it, but it reflects the kind of sanitation environment that they will have. And let me also add this one. In your recommendations, I didn't see this question of trying to sensitize the executive. And if I say the executive, you know where I'm coming from. Before the legislator comes in, everything must come from the executive about having a dedicated, not just any amount, but a dedicated amount based on the scientific studies like this. Based on that, the executive should present something to Parliament. Okay. And I'm sure all the committees in Parliament will gladly support any such move to raise enough revenue to fight sanitation.
Thank you, sir. He's the MP for Mansu Edubia, by the way. Well, please bring the mics here. Prof, I think let's take about 4 or 5 questions. You consolidate and then you respond. So, Honorable Titus Bayu.
Thank you very much.
Okay. Is the mic working?
Hello? Okay. Thank you very much. And it's a very good presentation, very revealing. I have 2 questions. The first one is a bit similar to what my senior colleague asked. The amount invested, how was that obtained? It didn't come out very clearly. Is it the amount located to the MMDAs that is focused on sanitation? Are you calculating as a percentage of their district assembly allocation, or how was that amount obtained? That we can be sure that that's the amount invested in sanitation. And secondly, you were mentioning about 1 Ghana cedi investment and the returns. How much of that 1 Ghana cedi invested is wasted? amount, how much of the amount invested to manage waste is actually wasted and not used for the management of waste? And the last question is, in terms of the daily earnings, I see the link with epidemiological data and the various medical conditions and what it will cost. I think there's one assumption you have made, that everybody who will fall ill from any of these conditions is actually productive. We have a high unemployment rate, and there are people who may not be contributing virtually nothing to the economy in a day. Did you factor in the level of unemployment, the age group of people who fall ill, whether they are actually productive or not productive, be able to come up with these calculations? If not, then there will be some problems with the estimates.
Thank you. Please stay on that table. Hand it to Giselle.
Thank you very much for the opportunity. I'd like to add my voice in commending you for this study in the first place. I think it's a national problem, and to introduce this dimension of looking at it is commendable. Because I saw waste management, I'm interested in the analysis of waste itself. I know this is just a short presentation and you have a full report. Did you consider in the study the analysis of waste that we have, waste segregation, the components of waste that we are dealing with? Did you factor that in this cost assessment? Because I'm looking at biodegradable forms of waste and how, if it's handled properly, that goes into fertilizing soils, and that may not necessarily be waste at the end of the day. That's my interest. And then in recommending investments, what categories of that management of waste do you lean higher components of the investment recommendations in? Do you, if you have done the analysis, then maybe you'll be saying that we should invest more in the organic components of the waste because we will have beneficial outcomes in say fertilizing soils and so on and so forth. Did you consider that in this study at all?
Wonderful.
Thank you.
I think we can take some answers for this first round. We have about 6 questions, but we can consolidate them just to remind ourselves. Your inform Ado wants to know whether you included the informal sector in your costing, because he says the two are different, and he feels you even underestimated or you overestimated the amount of money spent. And then he also wants to know whether you went ahead to make recommendations about the executive and what they should do. I need to say that we have people from the Ministry of Finance here. Please, are you here? Ministry of Finance, can you give us a wave? Yes, officials from Ministry of Finance are here as well. Then Honorable Titus Bayu, similar question to Frimpong. How did you obtain the amount invested? It's actually my first question as well, so it's the same question asked 3 times. And then how much of the amount spent is wasted? All right, and then this assumption around sick people, whether you didn't just include every sick person and translated it. Some of them may not even be productive. Didn't you overestimate that? And then Giselle wants to know whether you disaggregated the waste components, because not every part of waste is waste. So if waste can become compost, how did you do the disaggregation? So those are the questions I remember. I hope I haven't forgotten any of them. Yes. So Prof, do you want to sit there and answer, or you want to come? He said you should come here. Yes. So please come with him. So you answer some. The two, the presenter. So Prof will stand and you sit here. So when you finish, you can add some. So Prof will come and stand here and answer. Doc. Yes. So you can just sit here, but you'll be here for the coverage. Yes. Please go ahead.
I think I will invite my colleagues to join me, Kwame. No, come. All of you, Ralph, and then Evans. We all part of the team. Come and sit down and thank you so much. I could see the interest this has generated, and we were conducting the study. We in fact, initially we didn't have that much information, that much interest. So our interest was also very much aroused when we were conducting this study, and we saw the numbers and spoke with all the key players. There's a question about the data. How did you pull the data? In fact, all the relevant ministries, sectors, subset agencies will try to collect as much data as possible. I wouldn't say our data is perfect because you know our country. I mean, we don't have data that you can easily pull. We have to rely on all the subsectors, sub-agencies that could give us data. It's not 100% perfect or complete, but this gives us some scenario to take away so that we can work on the data and get. So I think we are providing you with a minimum as possible and then generate interest. And it tells you how well or how unwell we are doing with our data. The best case scenario plus the business as usual scenario, you could adapt for government or private. I think the figures we gave was to show if there's a private investor who wants to go into this kind of business. Of course, it may vary, but the figures we gave are for both government and private sector. The formal versus informal sector, getting data from an informal sector is quite difficult to get. That's why we use a national average, the minimum wage. Yes, if you go to the informal sector, there are people who earn far above the minimum wage. There are those who also earn far below the minimum wage. But roughly, it gives us an average, roughly an idea of what the sector looks like, what the incomes are, and so on and so forth. The sensitization of the executive, we are going to do that. In this presentation, you cannot bring out everything. As I mentioned in my presentation, we are going to come out with policy briefs, we are going to come out with regular engagement, etc. We'll be going to some of the media houses and all that, but there's a policy brief. I think a copy is even out there. I know for MPs and most of you are quite busy people, so you might not be able to digest a 60-page report, but a policy brief, when you are in your car moving between meetings, you can digest that. So we are going to do all of that so that the executive and the legislature and everybody would have something to work on. Yes, and then there's the amount invested. There is a talk about the $1 and the return, the $5.5 return. If you invest $1, you get a return of $5.5. And the question is how much of it is wasted. We didn't calculate that, but previous study that I've done shows that our investment efficiency is around 61%. In other words, if you spend 100 cedis, you're likely to get 60%, 60 cedis. We waste close to 39 or 40 cedis. I have a study that I did on that, on government public investment and the return based on a World Bank model. So we can rely on that as well. I would like to cede to the rest of my colleagues to also speak to some of the issues. I could, but I think they are also very seasoned persons to speak to the issues. Thank you very much.
Okay, so to add to what my lead researcher said, of course, we couldn't have estimated the waste. What we did was a best case scenario. So what we are saying is that if the $1 or 1 cedi is going to be highly efficient in spending, this is how much it's going to generate. And because we even use very low figures in our estimates, we went more to the lower side. What we have stated in terms of the benefits is supposed to be actually higher than what you have there. And so if government does invest, and it doesn't have to be government who do the right investment. I mean, for instance, you have private sector investment so that they can recoup back. But if you look at the quantum of returns that Ghana will obtain from that investment, it will be fine the government to allow private sector companies to be involved, because they'll be much more efficient in their spending of that cedi to generate the benefits. Also, we couldn't have looked at both formal and formal sector, but What we did was a national average. So what we have is a national average that incorporates everything. And if you look at our analysis and read the reports, we consider different types of waste. So we didn't put them together. And Kwame will speak to a few of that. One of the slides, we had information on that. And even in terms of investment, how the investment can also generate itself in terms of revenue. How do we decompose some of them into fertilizers and all of that? So it's in the report, and that is part of the calculation that we got for the investment returns.
Okay. Thank you. Please, can I have the slide up? Picking up from where Prof. Turkson left, yes, so we did, no, not this one, the slide, not the Excel. Yes, thank you. So, I think over here, very well. So, in terms of how we should manage this, what proportion should go to waste collection and transfer, look at the bottom right of the screen. What proportion should go to managing landfill sites, recycling, and then composting 24.4%. So that the different types of waste and what to do with it was part of our modeling, and there's detailed information on that in the report. But yes, I didn't mention this in my presentation. I apologize for that. There was a question on the unemployment. So I have to say that there are a lot of assumptions we've made, and all of them are, there's evidence for that. I'll ask Dr. Otieku to speak on the unemployment bit, because we are using unemployment rate from GSS to feed into our model, and so all of that is accounted for. But Dr. Otieku, you could probably talk on that.
Thank you so much, Kwame. Our analysis looks at the societal perspective of things. Okay, so we are not limiting it to a patient perspective. In health economics, you can do what you call government perspective, societal perspective, patient perspective. We are looking at the bigger picture. So, for example, an under 5 child who is at risk or gets malaria out of exposure to waste. Obviously, this under 5 child will not walk him or herself to the hospital. It means that he or she will have to be accompanied by a parent, a relative. And so the human capital approach to quantify the losses in productivity is the father working, is the mother working, the person who is accompanying them is the person working. So these are the things we look at. So we have built a very robust assumption sheet, okay, that take care of all these scenarios in the analysis. Thank you very much.
I want to take the next round of questions. Can you have some, please? All right.
Hello. Let me move from the MPs and deal with some non-MPs for now. So the man in
I'll come back to the MPs, please. So the man in blue, yes, you start. I'll give the third round to you. Otherwise, it will just be MPs. Yes.
Thank you.
Thank you.
I would also like, my name is Nate Tukoli Manuel, MD of Jakura Ventures. We operate a franchise agreement with the Korle Klottey Municipal Assembly. We haul waste, and the franchise means that we are not funded by government. We collect revenue from the clients we service, and then we use that to run our operations. I have 2 questions for the team. I think I'm getting an idea about where it's leaning to the answer, but still I'll ask whether the study focused mainly on the current approach model of waste management, whereby everything is lumped together and then sent to a landfill to be managed, or whether they considered looking at waste as a resource, and therefore in the allocation of investments they assigned some of it to the waste valorization process, whereby waste is not seen as waste but seen as a resource, recycling, and then it creates a new industry altogether, which is more attractive to the private sector because it becomes self-sustaining, self-financial sustaining. And at Jakura Ventures, for the past 13 years or so, we've been championing this. And from this, what we've been doing, we think that if that approach is taken, the current system whereby annually budgets are raised to manage waste, that sector would rather become a revenue generating industry, which will bring in more money for the state.
So that's your first question?
Yes.
Second one.
The second question is in the allocation of the investment resources, did we consider also the changing of the mindset, which will require that more investment is put into education, training our kids right from the kindergarten, primary, secondary school, so that by the time they even become politicians and they become policy holders, they would value the environment as the capital of nature. And once you see the environment as capital of nature, and we human beings are just subjects in it, we would forgo our pride in thinking that
Thank you.
we know everything. Thank you.
Yeah. Please go to the back. Yes. And while we are at it, I'd like to acknowledge Honorable Stephen Amoa. He's an MP. I think he came at some point. And also Professor Anthony Amoa, University of Environment and Sustainable Development, Somenya. Prof, if you are here, give us a wave. Thank you very much indeed. Please
all
go
right,
ahead.
thank you very much. First of all, I have two questions.
Yeah.
The first one, from your study, do you see or establish the need for government to support private waste management companies? It may not have come clear. And what kind of support will you recommend? Then the second one, I think we agree that regulation, enforcement, standardization are key in the management of waste and environmental sanitation. So do you have any recommendation on the establishment of a special regulatory authority, as some stakeholders have called for the establishment of a national sanitation authority to deal with these issues? Thank you very much.
Did you mention your name?
Yao Ata Ahen.
From where?
I work with World Vision in Ghana.
Thank you. Please stay on the table. The gentleman next to you. The one behind you.
Okay.
Okay, yes, okay, Apoya. You are in front of him, but
yes,
you took the mic.
Thank you very much. I think very good study, and this is what we should be calling for from time to time. A recommendation linked to the last speaker, I just wanted to even suggest that maybe in the recommendations we can have one specific to our MPs. If you are privileged to have people like this, I mean showing interest, what they can do is the regulations that are laid before them. That any such regulations that come, and it's about waste management, it's about sanitation, then in trying to deliberate on that, they can see the importance of actually ensuring that such regulations contribute to improved waste management, and therefore it will bring results to the country. So if there's no specific recommendation that is addressing the MPs directly, I propose we put it there. My main question, and that is a question that I want to really take away, is the proportion of malaria cases among the 5 candidate diseases that you have talked about. Everything is very good, but if it is the malaria that will now make the case, I get jittery, because I really now know, I know malaria is caused by many other things apart from waste. In fact, the water contribution of malaria is far more than the waste contribution. Irrigation water, farms, puddles, water that you leave exposed in your homes is far more, it contributes far more to malaria than waste management. That's having access to a toilet or you not collecting your waste properly. All the same, there's still a contribution of waste towards malaria, but very, very small. I'll call it very small. So if at the end of the day, it is the malaria component that is making our figures look that bad, then we need to still do some work. But if the malaria proportion is not anything more than 10% of the OPD cases or 20% of the diseases that we have put, then I will want to
just a clarification. When you say the water contribution of malaria,
like waste water that is not disposed of properly. So you have standing water in your homes, that is a hygiene issue. You have water line in farms, open puddles. That is where the mosquito that causes malaria breeds. If you take drains, it also breeds, but it is 90% killers. That doesn't contribute to malaria. So there are more of nuisance biting than malaria causing. So I'm not worried about mosquitoes breeding in drains, okay, because it's a small.
So if I get you, you're saying that if the component of malaria in the 5 is high,
yes,
it may artificially raise.
Bloat.
So they should explain the 5 diseases they choose and what weight they give to malaria.
Correct. What is the proportion of malaria in that?
Well, fair enough.
That's the main one.
It's the health economist is taking note. Give the mic to the next man. Thank you. Thank you. That's Patrick Apoya from, is it Koniwas? Wonderful. Yes, sir.
My name is Nyako Esiama. When it comes to waste management, basically we have best practices around the globe. If it is about recycling, we are going to mention nations like Germany. If it comes to like plastic waste, we are going to be mentioning like Norway. They have models that they use to recycle their waste. If you look at what we've done in Ghana, we used to have one strategic big private operator. Now we have moved into what we call the decentralized kind of system. In their approach, it was obvious that we have to increase investment. Did they consider whether we have to do the investment by looking at the current decentralized approach, or we have to have a hybrid where definitely there will be room for big players? Because when it comes to waste management, the investment is huge. And to be able to come with big ideas and be able to have an injection of technology and all those things, I think that there should be a kind of blend. So in their study or in their further study, if they can consider the kind of proportion that should go into the decentralized system and the kind of thing that can also be left for the big players. Thank you.
Thank you. I wanted to suggest something. The questions are a lot. We were supposed to take a snack break, but this is what I propose. We have split the snacks. So if the ushers can be taking the tables quietly to be taking their snack while the program continues, we will save time. So Vicentia, since you know which person can go to which table, you can be calling the tables one by one quietly to be taking their snack, so that we'll have a lot more time for the Q&A in a non-disruptive way. And everybody's snack will be preserved for them. So those of you who are not going now, nobody will touch your snack. So that we will not take the break and then we can get more into the, because when we take the snack break, we have to also go off air. And the listeners too, they are going to snack break, it will not work. So the program has to continue. Do you follow me? So she will manage that so that we can take more questions, because it's getting very interactive. Can we add one more question?
A quick one.
Yes, one more question before we go to the answers.
Thank you very much. Good presentation and good study. My question is, why didn't we see the assumptions? Because you are reporting on different scenarios. Now, once you relax the assumption, it changes the estimates, it changes the results. So I would have loved to see the assumptions, then the limitations associated with the assumptions. If you had done that, I think a lot of the comments wouldn't have come up. Thank you.
I suspect it's in the full report, but because it was a presentation, they jumped to that.
I get it.
Yeah, but you didn't mention your name.
My name is Anthony.
Anthony. The full report is actually over 80 pages, by the way. Maybe you should be sharing the full report at some point. It will reduce, but it's also good because the questions tell you that there's a lot of interest. Stika, I'll take answers to this round. Then when I come to round 3, I'll come to you, sir. Dr. Stephen Amwa. Prof, do I need to, you have the questions, right? I don't need to summarize. Okay. So, Doc, please, Prof, please.
Bernard, I think titles do matter. So next time you have to be careful. Yes. Especially, yes. We had a case in point where a professor went to the bank and he presented the check and was waiting for the money. They called the name without the title. He didn't get up. After some time, then they asked, what are you waiting for? He said, I'm waiting to be called. He said, well, we mentioned, what's your name? He said, well, we mentioned it. He said, no, we didn't add the title. So my brother, titles matter. Yeah. Yes, so that's on a lighter note. I think talk about the current approach, the waste as a resource. We are giving you what the investment figures should be. We have to decide how we distribute this investment. But your point about treating waste as a resource for recycling is very critical. It's something we have done in a different study, so we didn't delve too much into this, although we did touch on it. We had a project called the Green Jobs Project, where we looked at how within the waste management sector we could do recycling. So we have this study in South Africa, Kenya, Ethiopia, Uganda, etc. And it was quite a revealing one. Ethiopia, for instance, has developed a curriculum on green jobs, where their polytechnics are teaching people about green jobs. When we visited the ministry, and they showed us the curriculum and how they are targeting young people into employment, trying to get them into green jobs, it was just amazing. We invited some of our young people in Ghana who are also into green jobs, companies into green jobs, etc. So you are very much right. It is an area where we need to allocate resources in terms of investment. I agree perfectly with you about education. You see, after this forum, we have to take this forward, including our legislators, including all of us. There's a need for education, changing people's mindset, training, so that we see environment as a capital. We don't destroy our environment, and education is key. Yes, we have provided the needed amount for investment, but how you allocate into education, into physical infrastructure, soft skills, etc., is quite critical. Government support to the private sector. I think regulation standards, etc., are the things that government can provide to the private sector. Government can also provide some opportunities for credit, for instance. If a private sector investor needs money to invest, I think the opportunity should be there for them to invest. Also, the needed infrastructure, that when it comes to road, it comes to electricity, water, that should be the role of government. Government should not be in the business of direct production. Government should provide the enabling environment. And I'm happy our honorable MPs have made time to be here. It's just the beginning. I believe they have taken copious notes. When they go back, they know the numbers, so that when they are arguing for their sector to be supported, they know how much we need and what etc. we should provide. A special regulatory authority for waste and sanitation management. I'm not a fan of creating so many institutions. Ministry of Local Government is there. Maybe a unit within that, or but if you are not careful, you'll be creating more institutions. But well, if we think it is necessary, that's fine. But personally, I think we can manage if the ministry is able to do this and provide a regulatory oversight. That is fine. Recommendations for MPs. I think the MPs have taken those already, and I believe they will take the policy brief and all the things that are required. I would stop here and also invite my colleagues to also add on the need about the malaria, the weight we are assigning to malaria, and also malaria cases, etc. Recycling best practices.
Yes, thank you, Prof. So one of the assumptions included in the modeling, which we obtained data from WHO Global Health Observatory, the assumption is that for all these conditions, approximately 45% of it is attributable. There's what you call associated with and attributable. Attributable means you can really say that this is what is driving it. So 45% of the cases are attributable to waste. So it is on the basis of these assumptions that we derive the numbers we have in the computation. I hope that answers your question, please. Okay.
So maybe just to add to the issue about assumptions, clearly we have an assumption sheet, and we have the percentages that these assumptions would contribute in terms of the impact that they are having on the figures that we see. But let me talk about education and the fact that it's an important component that we can't take away from waste management and sanitation issues. In fact, in our assumption, we have awareness of the various components that we see, like composting, sorting, etc. And we see about 37.1% impact on all that we are seeing with regards to waste management. But this is complementary because education alone cannot play the role. You have so many other things that are also contributing to that. So that's it's a well-taken comment. Definitely need to show the assumptions and some of the implications that they may have, and the limitation to those assumptions as well. Thank you.
Thank you. Please put your hands together for the ESET team. So just to give you a sense of why the questions are being shared, apart from Professor Korte, who is the team lead, and Professor Turkson, we have a health economist, give us a wave, an agric economist, who just answered the question, and an environmental economist. Please raise your hand. So these are all various emphases, which is why the report does all those things. So we'd like to take the third round of questions. Whoa. Okay. So how do we do it? Okay. So let's do the middle small.
Okay. Thank you very much, Prof. Kwati and your team for such a wonderful presentation and very detailed work. I just have 2 quick questions. On the issue of attribution, I think the figures differ considerably depending on the conditions. So I think you should do some sensitivity analysis, because the first presentation that was done, when Prof. Kwati spoke, he said a study was done earlier where $1 investment yielded about $5 return. So yours is extremely high, and it could be due to the fact that the attribution was not properly done. So you may need to do some sensitivity analysis. The second thing is that as the economy improves, people generate more waste, and then as population grows, more waste will also be generated. So did you account for these changes in your computation of the cost?
Hello, please. My name is Patrick Akoff from Zumulaya. Yes, from the presentation or service provider point of view, we all agree that waste management from the slum areas or rural areas is very costly. But usually the government only attach little cost to the management of the slum areas. So which makes it very difficult for the service providers to actually put much emphasis on such areas. So I want to find out what would be the recommendation to the stakeholders when it comes to the waste management in the rural areas and the slum areas. Thank you.
All right. Thank you. Thank you very much. I have 2 questions. My first question is, we looked and listened to the presentation, and we get a sense of an organized environment where we have nice, beautiful waste bins in front of every house, dumping the garbage truck is picking up. We know that that scenario doesn't necessarily apply to our environment. How are we accounting for the uncollected waste? The one that is littered along the way. The one that we are throwing in the gutters. The ones that we are dumping in the water bodies. How are we accounting for that waste? My second question is looking at the health, the breakdown on the areas of health that affect productivity. I found it curious that a health condition like typhoid was weighted at 4 days. I am not a medical doctor. I've suffered typhoid before. I've seen people suffer typhoid, and I know the recovery is more than 4 days. I don't know how we arrived at this for the weight. So these are my 2 issues.
Thank you. Very much. Yes, sir.
I'm Dr. Abukar Rumbe from the Community Water and Sanitation Agency.
Sorry, from where?
Community Water and Sanitation Agency.
All right.
Looking at the scenarios presented and the cost estimation per areas, I realized that this was talking more about solid waste. People have already asked questions about the waste categories. Did you consider liquid waste in your calculations? Because that is an area that we still have opportunity to invest. And that is an area that is also causing a lot of havoc as far as our health is concerned.
Thank you.
Thank you.
Thank you, Dr. Amwa. This is the last one. Yes, sir. It's not. Please give him the mic. Please give him the mic.
Hello. Yes. Thank you. I'm sorry I was late. I haven't been too well, and that's why I was late. And I didn't have the opportunity to watch or listen to what was presented. But it's an area that I'm so much interested. That's why even when I wasn't well, I had to come. I think this country, our major problem is the fact that most of our policies are not preceded by any well-conducted research with data that have integrity to back what we do. So we don't have normally policies that are implemented sustainably. I don't think we have to do long talk. Some of the questions we're asking them, they should ask us as politicians. Can we, for once, get something out of this exercise? Because we've been doing this for almost 30 years. NDC guys are here, MPV guys are here. I stand to be corrected. I'm sure we have the National Research, it's a Fund Act, 2020 Act. It's Act 1056. And it stipulates that at least 0.5% of our revenue budget, not even the expenditure, annually should go into a fund that had an embryonic fund of about 50 million. The question is, do we go by this? Because even if we have 0.5% of the expenditure, we are supposed to have minimum 100 million Ghana cedis. That is a year. So I'm just suggesting this out of what we have discussed, that we, the MPs from both fraternities, when we go back, we should push and fight. One, all state universities that do not have well-established research faculties, we should do something to do that within about 2 years.
All right.
3, every year, at least the 0.5 should go to the universities. And if we do that, it will help us. Because I realize that billions that go into emolument every year in our country, I'm not saying others from the ministries you are not working, forgive me. But if you are really critically dealing with productivity, apart from education, health, and public security, we found one thing when it comes to productivity.
All right.
And for Ghana to have sustainable economic framework, I beg this country, research is key that both MPP and DC can tap into before we promise Ghanaians. That's what I want to say. Thank you very much.
I like that. I think you put your hands together for him. He's basically saying we don't need to ask too many questions because they have done their work, and a lot of people here are duty bearers who should rather be inputting this into their policy framework. So, Dr. Mo, I thank you. But I'll still allow you to answer this round, and then I'll propose that we do one last round after that. And after the last round, we'll do a panel discussion where you can also engage. I acknowledge a few more MPs who have entered. I see the MP for, I think, Efia, and other MPs who have come. You are welcome. We really appreciate your attendance upon this meeting. So, Professor Korte, this is round 3. I hope you took note of the questions. Thank you, sir. You want to allocate the answers?
I would start and then my colleagues would come in. I think the issue about the assumptions has been spoken about then. Attribution. Yes, you are very much right. Sometimes when it comes to attribution, you can't attribute everything, but the analysis points to one thing: how much we need to invest, how much we need to, if you want to do attribution, then all the rigorous estimations, econometric analysis, sensitivity analysis, that would come in. But at least this is the beginning to show. Now, your point about the World Bank study, yes, it showed that $1 invested yields $5.5 returns. But that was a study done in 2012, way back, and of course, it's all averages. This one, we are talking of Ghana. It could be average of other countries, but if you are talking of Ghana, this we think is more current. We are generating more waste, and our burden of diseases is much, much higher here than you may find in other countries. So this is what our figures show, data we collected from our own ministry departments and agencies. Yes, as an economy grows, our waste also will grow. So if we do a trend analysis, the figures might change over time. Managing waste in slums is very much on point. I mean, it's more expensive. In slum areas, some areas are not even accessible. You can't put waste bins in slum areas, they will disappear. Accessing some of them, you cannot use the trucks. You may have to use aboboya or some forms of waste collection. So yes, it is expensive, and our recommendation would be that we can't have one size fits all. We cannot say we want to do the formal one where we have all the big trucks. We also need the small ones, except that they have to be regulated. You find some of these trucks, this aboboya, driving in the opposite direction on our streets. Sometimes the waste are not covered. By the time they reach their destination, half will be on the street. I think we need to regulate the operations. How do we account for uncollected waste? I will leave that to my colleagues to answer. Health breakdown, I will leave that to my solid waste. I think we touched on solid liquid waste, etc., but my colleagues will come in. I just want to finish on the last point, our investment in research, 0.5% of revenue. Dr. Amwa, yes, I've used the title, so I'm fine. I mean, I can't agree more. We don't invest much into research. Most of the time, we are in a hurry to implement policies, and I think it's about time we invest more in research so that whatever we come out with becomes more useful. I've been in this research business for some decades now, since I completed my PhD, and you find that Western institutions, USAID, World Bank, IMF, those are the ones who come and use our research. They are always funding us, they are always asking for research. Our governments do, but the extent to which they prioritize research, I don't think we are doing that as a nation. Until USAID left, we had a contract with them. For 5 years, we're going to evaluate all the things they were doing in Northern Ghana, health. You could see how much they prioritize research. How much we put in our budget for research? Very minimal. And I think from here, but that's why we are doing this, from here, our honorable MPs and everybody here, the private operators, let us work together. Let's see how we can generate the evidence to help support your businesses, to help support our country. I'll invite my colleagues to continue. Thank you.
Thank you. I will quickly touch on Honorable Zure's question. How are we accounting for the uncollected waste? So in the best case scenario, there are different standards for different categories of countries, and these take into account the peculiar characteristics of those countries. So for example, for LMICs or lower middle income countries, then the we are not looking at countries that have a perfect system or a near perfect system. These are countries with the challenges that we have, and therefore those amounts, which the standardized amount is supposed to take care of all of those limitations that we have as a lower middle income country. So that is well accounted for within the framework of what we are doing. That is handled because we are a lower middle income country. Our characteristics and features feed into that, and that is why those amounts are given. And as I said, it's a range, and so we just, for the purposes of the analysis, we stay within the middle band of the range. So yes, if we have a lot more slums and so on, then maybe we should be going towards the upper end of the range than maybe staying within the middle of the range and so on. But all of these are tested in our assumptions. So if we stay in the middle, what is it? If we go up, what is it? So those kind of sensitivity analysis exists, but then for the purpose of this presentation, we choose to be near neutral, stay in the middle somewhere. Yes. Thank you.
Thank you. So let's take the last round of questions with the view that if we don't take the rest, we'll do the panel. MP, sir.
Yes. Thank you very much, and permit me to just introduce myself once you didn't do that. So I'm Honorable Dr. Sebastian Mwenenso Sandare, the Member of Parliament for Dafiama Buse Issa constituency. I'm the Vice Chairman of the Health Committee and also a member of the Local Government Committee. Okay. Thank you very much.
Thank you.
I just have two quick questions. One, if I look at the project topic, it's on economic analysis of the benefits of adequate investment, waste management, and sanitation in Ghana. And you chose 5 disease conditions as part of your analysis. But when I look at those 5, you have typhoid, malaria, cholera, diarrhea, and pneumonia. The first 4, one can say directly have some link to do with solid and liquid waste. My concern is why you included pneumonia, which has to do more of, let's say, the environment, the kind of air that we breathe in. Yet in your data and whatever in the analysis, I didn't see any possible entry into the kind of air that we breathe in, you know. So why did you include pneumonia when it's really not something to do with solid waste or liquid waste? That is one. And lastly, one intervention that is going to break or reduce the burden of these diseases would be the primary healthcare, the free primary healthcare. And if you look at the Alma Ata Declaration, waste management and sanitation was a core component that if it's well managed, it has the potential of reducing our disease burden, especially these conditions that you have mentioned. The free primary healthcare that the government is bringing as a bold intervention. In your recommendations, how do you, as a way of policy or moving into the policy direction, what recommendations do you think your study would kind of advise in that area? Since if it is well done as an intervention, it also has an impact on reducing the disease burden. Thank you very much.
Okay. So when we are done, we'll go to the table of Fugu. Yes, so you'll be number 3. Let me just take this
very
one.
much. Thank you very much. And let me commend Professor Kote and your team for this beautiful research done. I'm a member of the Sanitation and Water Resource Committee of Parliament. And many groups have been meeting us with research and data. What I want to put before your group when you are, when you are writing the policy, you see, we have done, sanitation is an area that is not lucrative. many business persons or private sector people do not like participating in sanitation businesses. It's not a lucrative area. It's not like road contract. Many people want to be, road contractors. They want to supply, they want supplies. But this area is an area that we need political commitment. So in looking at the policy, let's look at political commitment. In all of this we've been doing over the years, we haven't been able to be on the road because of political commitment or lack of it. So for instance, you have many ministries or agencies that are actually, let me say, pretending to be solving sanitation and sanitation related issues. The knee-jerk approach will not help. So that is why, Prof, I will want, as part of your recommendation, somebody mentioned it, if we can do a synergy, synchronize all the agencies that are dealing with sanitation and sanitation related issues into one umbrella, so that government will be committed to it. Resources allocated to this agency will actually, can be used to deal with sanitation and sanitation related issues. So in this reason, or in this regard, I recommend the National Sanitation Authority, we should actually have it. We should actually have, you see, Ministry of Local Government is dealing with sanitation issues. We have Ministry of Environment. We have Works and Housing, other agencies. So, but this is what we've been doing over the years, and we are not getting the results. Right. So let's come out with one agency. So I also recommend that if we have a national sanitation authority with decentralized offices, it will help. Then we look at funding source of funding. Let's be very clear. You see, we brought sanitation, a pollution levy, to use to deal with sanitation related issues. It's been scrapped. When I say scrap, it's been taken to do other functions. You cannot deal with sanitation issues without a dedicated source of funding. It's not possible. If you go to the local assemblies, MMDAs, they don't even have a decentralized department for sanitation. They don't have it. And sanitation issues is always one thing that they don't even treat seriously. They don't take seriously in many of the MMDAs. So you need a dedicated source of funding. Somebody also mentioned that attitude. How do we keep or deal with the attitudinal issues? We can put this in the curriculum. Okay. So that we can catch them young. So these are some of the recommendations. But for me, private sector, government should create an enabling environment for private sector participation in sanitation issues. Thank you so much. Thank you.
Please go ahead.
Thank you very much, Ben, and thank you for acknowledging my fugu. Prof, that was a wonderful research, and anyway, I am Jerry Amuafu from TMA. And I'm excited that this has come at a time when just this week we have heard that the Cone landfill site is going to be capped in a month's time. So it tells us that waste management is a very serious thing that we all need to consider. Nonetheless, I'm wondering if we are not to cap Cone, then it means that we need to be recycling. Mm-hmm. Or if we are not to revisit the Cone situation, then recycling is the way forward. But I see that in your allocations, you say recycling, that is about 14% out of the 4. What would you recommend that assemblies, that is the MMDAs, that we do, and actually we invest our energies? Because as for TMA, we have been frantically exploring investors into recycling. But what do you do? What would you recommend that generally MMDAs will divert their attention to in terms of waste management? Thank you very much.
Thank you, sir. Madam.
Good work done by the team. This is a very insightful one. First of all, I would like to say in this room that most often we refer to the low-income area people as the people who generate more waste. It is really false because global data clearly shows that the high-income area people rather generate more waste. I'll put that on the side. A good work has been done as we've seen here. Going forward, I would actually like to see in your recommendation that there's a dedicated fund set aside to manage waste management in Ghana. That's the first one I want to see. And then I would like also policy to drive our EPR system. A good example was made here from Germany and Norway. We can use Rwanda, we can use Singapore. We can use these basic examples actually also to streamline what, so that we don't go back reinventing the wheel. Because if we say it's the same continent and we have the same patterns of managing waste, then I think we should go and study some of these things and replicate this as well.
Please tell us your name.
My name is Vivian. I'm from City Waste Recycling.
Good.
And there also, I would like the informal sector, like it was said earlier, to be at the forefront of this to promote what we are driving at. And then policy would actually set the tone for all these conversations we are having because the policies are there. How do we implement that?
All right.
And then the last one is, how do we attract investment and also protect people who have invested in the system already?
Okay.
That's what I'm looking out for
Thank you.
in the recommendations. Thank you.
I'm still on the table, the Fugu table. Is there a question from there? Yes, we'll take one last. Yes.
My name is Paul from J&K Waste. In the cost analysis, I realized that the collection and transfer of the waste, the cost they gave, I would like to know whether is, I don't know how to put it, sorry, whether the cost is about the holistic collection to the dump site or it involves segregation at source.
Okay.
So if it's segregation at source, maybe it may reduce the cost at the recycling site. So I'd like to know whether the
How
cost
they did that? Okay.
Yes, yes.
There's a man next to you. Give the mic to him. Yes. The man in glasses. Yes.
Which man?
Or is it a woman? Sorry.
Please, I'm a woman.
I need new glasses. Forgive me.
That's fine. I'm Nora Oleno from Alliance for Wash Advocacy Network. And please, I would like to commend the team. And secondly, I want to find out, beyond the investment levels or based on the evidence generated, did we look at the efficiency of spending? Are we underinvesting? Also, what financial models would you recommend? Moving away from here, since we have duty bearers here. Thank you.
Prof, so the questions are many. I hope you have a rapporteur who's putting everything together into some form of report. This is the last round, so let me give the MPs who came in. Please give the mic to the lady in blue. The lady in blue. Then I'll give the last question to this man. Oh, you have questions there? Okay. Should we take more? Okay. Madam, you have the floor.
Thank you, Prof, for such an insightful presentation. I'm Philomena with Series Systems Ghana Limited. So then I want to ask, we've had this research, but then is it the first of its kind in the country? Even if it's not the same, probably there are similar studies that have been conducted. But then what was the outcome? What did we do with it? Prof mentioned that elsewhere, they invest in research and they use it. But with our part of the world, it's like we do the research, the findings come out and we talk about it and we go home to sleep. So how will your team ensure that this research doesn't end up on our shelves or in our library, but then we act on it? Thankfully, we have stakeholders are here, the lawmakers are here, researchers are here. So what do we do so that this research doesn't end up on our shelves, but then we act on it? Thank you.
Thank you. All right. I just wanted to see by hand how many people have questions so we can take a decision. 1, 2, 3. It's just 3 questions. 4, 5. Okay, and then the MP6. All right. A lot of the questions I was going to ask the panel have already been asked. So what I propose to do is, there are about 2 members of the panel here who have not been questioned. So I'll ask them a couple of questions in the course of the discussion. So we just use the Q&A, because the whole point is to generate insight from the report. And the questions are doing that already. So I don't see why I should have another panel discussion. So Espa, I have a couple of questions for you. And another member of the panel, Engineer Godfred Fifi Buedi, are you here? Good. So I will throw a couple of questions to you as part of the Q&A, so we can just optimize the time. Please, is that a good plan? Beautiful. So we will answer your question as part of this round, then I'll do another round. So there will be no panel discussion. So we'll just do 2 more rounds of questions and then we are done. All right. So let's take these answers and then we'll do the 2 final rounds. Thank you very much. Prof.
Thank you very much. This is one of the few engagements I've had with such an interest. It tells you that the people we have in the room are well versed, alert, and very much interested in the topic we are discussing. So thank you so much. There's a question about what should MMDAs do. There are a couple of them, but I think waste segregation for me is key. I don't think we are doing a lot of waste segregation where you have, in other jurisdictions, you find the yellow, the green, so that people segregate waste. Then it aids recycling. For us, there's nothing like that. And even providing bins, waste bins, has become quite difficult. And people then throw waste about as and when. I'm told when it rains, some even throw it into the rainwater. I think we need to overcome this challenge. Waste segregation, education, providing waste bins. The MMDAs, I think that should be one of the focus. And also engaging the agencies. There are many operators around. I wonder whether they are registered. You know, some of these tricycles and all are they registered? Are they regulated? Who looks after them? Who educates them? MMDAs should focus in that respect. I think the other one looks more of a suggestion. Low-income areas generate more waste, and then you went on to provide some suggestions. A good EPR system. They need to engage the informal sector. I think in my previous submission, I said, yes, we should do both, the hybrid. We shouldn't leave out the informal sector. How do we attract investment? We've spoken about how government can provide an enabling environment to attract investment, also protect investment, very critical. The cost separation separation at the source for recycling. I think it relates very much to my point earlier. So, you know, efficiency of spending. I spoke about the inefficient, how much we lose through inefficiency and all that. So I would research impact. There's a point about how we'll ensure that this research would have impact. Earlier on, we spoke about the need to provide policy briefs, the need that we're going to share the report, and we are not going to end here. We are going to engage further on radio, TV, to ensure that whatever has been discussed is taken further. And I'm quite happy to see our honorable MPs here as well, who will take on some of the discussions to Parliament, so that we get value for money in the little we spend on waste management, and also accelerate that. Let me invite my honorable colleagues to also join in. Thank you.
I guess there's one question that the MP asked, but I think it's left. Pneumonia is linked to waste and sanitation, because when the environment is dirty, when hygienic conditions are very poor, when the air is polluted, out of poor sanitation, waste management. These are the conducive environments that allows pneumonia to thrive and spread. And therefore, you find that happening normally in slums because of these conditions. So whilst it is not direct through waste, poor sanitation has everything to do with pneumonia. That's why you have pneumonia on that list. I guess that's all that we have in response. Okay, thank you.
Thank you. So we're going to continue with 2 rounds. I'd like to ask Professor Korte to stay. The rest of you can take your seat. And then I'll ask the panel members to join, but the Q&A continues. Engineer Godfrey Fifi Boedi, Head of Climate Action, Sustainability and Partnership, Ministry of Sanitation. Let's put our hands together for Engineer, who is also a lawyer. Madam Amma Ofori Entry, Executive Secretary, ESPA, which is Environmental Service Providers Association, ESPA. Please take your seat. And Honorable Zuwaira Ibrahima, MP. Is this Salaga South? Yes. I don't like the way the women are in the corner. So you go to the end. So the women must be in the middle, so you go to the end, the man. So it will be nice. Very good. So this is what I'm going to do. I am going to ask each of them a question. After they answer, we'll still continue the Q&A because he is the lead researcher. He's still here. Please, is it making sense? Wonderful. Well, before I do that, I'd like to acknowledge the second vice president of ESPA, who is also the CEO of J. Stanley Owusu, William Stanley Owusu. Is here. Can you give us a wave? Thank you so much for being here. Put your hands together for him. Please, is the program making sense? Are you learning something? It's going well. Okay. Sometimes when you are here, you don't know. I'd like to acknowledge the MP for Cape Coast North. Cape Coast North. Put your hands together for MP for Cape Coast North. There's an MP here. I don't know your constituency. Bekwai. Oh, MP for Bekwai. Oh, Deputy Ranking for Water and Sanitation. Put your hands together for him. Thank you very much. And I think the point made about the fact that this is almost the first time we have research that may impact policy is a very important point. And I want us to put hands together for ourselves for putting this together. It's been really good. Environmental Service Providers Association, what is your general response to what has been said? We've seen the research. It's clear that more investment, targeted investment is needed in the sector. But you are private sector players. How welcoming is this research for you? And what are your initial thoughts? Madam Amma.
Thank you, Bernard. As you all witnessed this morning, it tells you that waste management or sanitation is a key economic indicator. We are now looking at sanitation from an economic perspective. And you could easily tell that indeed, if government is committed and we have more resources channeled into the sector, we would have our economy improving. It means sanitation is an economic indicator. It cuts across all our sectors. Our health will improve, tourism will improve. Let's take job opportunities. If indeed we are going to look at what Mr. Tokuli talked about, we're going into recycling. Today, if Ghana as a nation, we are committed to recycling, what is going to happen? It means there will be job for the youth, employment. Even let's just take from the point of generation to collection, treatment, recycling. And then we are just looking at the R's, recycling, reuse, repurpose, remanufacture, repair. Let's take all this sector. Even the recycling. Imagine we have an industrial hub, a recycling facility in all the 60 regions. What is going to happen to our economy? We are going to have our gross GDP increase because there will be enough job creation. Let's take Rwanda, for example. Why is Rwanda attractive? Why would a lot of people go there? Because it's claimed that it is clean. So as a country, if we can invest into our sector and our country will be clean, what is going to happen? We have a lot of tourism. When tourism is happening, what is going to happen? Increased foreign exchange. What is it going to do to our economy? We'll have a lot of foreign income coming in. And obviously, our economy will improve. So sanitation is interrelated. We can never have our economy improve without we taking sanitation as a key indicator that government needs to consider. Because it comes across. So it comes across as an economic indicator that we need to look at.
Thank you very much, Amma. I'd like to bring in the engineer from the Ministry of Sanitation. I didn't know there was a ministry like that. Well, I'm reading what they've written in front of me. So you are with local government now. Okay. So what are your general reactions to what you've heard as a Minister of Local Government, and what kind of partnerships do you see going forward to increase investment in sanitation and waste management? Engineer Bwedi. Oh, guys.
All right, thank you. And it's fun to be here because there is a lot of learning and there is a lot of interest we are seeing. But most importantly, Bernard, I would like to start from painting how an ideal system should be like.
Okay.
Then I could come to what the system currently looks like. Then we can take it from there.
All right.
So the ideal system often operates that you have a ministry that sets the policy direction. You have a regulator that approves tariffs, sets standards, and license operators and facilities. Then you have the MMDA that contracts service providers or operators.
Okay.
Then you have the operator that deliver on the service. Then you have the regulator that certifies the performance of work done by the service provider or the operator.
Okay.
Then you have a dedicated fund that disburses payment for based on the certification issued.
Okay.
Then finally, the regulator comes in to enforce any non-compliance if needed.
Correct.
So that is the ideal system. If you look at different sectors of the economy in this country, you have the ministry. So for instance, if you pick education, they have education, district education offices. For health, district health offices. They still have the ministry.
Yes.
Yet in between the policy and the operations, you have for health 26 agencies with numerous of them being regulators, regulating different aspects of the services.
Correct.
Regulating even up to blood, tissues. If you come to education, there are 10 agencies in between the ministry and the district education offices, regulating different aspects of the education.
Good.
Now, if you pick the sanitation and waste management sector, you have the ministry, you have the MMDAs, you have zero regulator. So that is the first admission.
There's no regulator.
No regulator. And oftentimes people confuse the work of EPA. Sometimes they bring PURC and others. But you see, the role of EPA is very focused on pollution, which is incidental to the environment. And so that's why they issue permits and not licenses. And so we could go on and on, but it has to be said that we have a missing link.
So in the sanitation sector, between the ministry and the MMDA, there is no single regulator?
No.
Wow.
Zero. So that is the first point to be made. If you look at the policies, we have all the policies. In fact, according to one colleague who works at the World Bank, he said that per the last count, he had over 100 policies, programs, and plans in the sanitation and waste management landscape alone. 100
policies?
Over 100. So that is the first point.
Okay.
When it comes to private sector participation, we have, this is one of the sector that has the heaviest, one of the heaviest private sector participation. Now let me pick just waste management. We have over 484 formal service providers providing collection and transportation services across the country. Number one. We have over 4,000 to between 4,000 to 5,000 informal operators doing collection and transport as well.
Wow.
When we come to treatment and final disposal, I can name numerous facilities. We have landfills, we have integrated recycling compost plants, we have some MRFs, we have material recovery facilities, we have transfer stations, and all these facilities are capital intensive, they are long term, and they are technically complex.
Wow.
So that is it. Now let's go to the financial flows. There is a lot of financial commitment even on the part of government. And so maybe let me come to how the system currently operates or it flows. So the collection and transport, let me deconstruct the collection and transport separate from the treatment and disposal. Now when you come to the collection and transport, you have the ministry setting the policy direction as usual. No regulator. You just come to the MMDAs who contract, then the service providers provide a service.
Wow.
And then now, even in terms of certification of work done, I mean, much can be desired. I don't want to go into that. And then you realize that the service providers who have been taxed to provide a service are the same entities taxed to go for the revenue mobilization.
All right.
So that is something we need to look at. When you come to the treatment and disposal, you have the ministry setting the policy direction. Because the treatment and disposal are facilities that are very capital intensive, long term, like I mentioned. You have the ministry, you don't have any regulator. And you are dealing with huge, I mean, we are talking about huge sums of finances or value flowing through there. And there is no regulator, and what you should expect is that there will definitely be financial leakages. And so that is number one. You come to the next step, and it's not the MMDAs that are contracting, because a lot of these treatment and final disposal sites are transboundary in nature. And so if you have a landfill, even though it is situated in, let's say, Adenta Municipal, it is not only used by Adenta Municipal. It will be used by multiple MMDAs. And so, given their nature, because we don't have a regulator, it is forced to be absorbed under the work of the ministry. Then, the ministry now has to now come in and sign these contracts. And the ministry doesn't set service standards. That is the work of a regulator. And so the ministry somehow will have to be playing that role as well. And so, I mean, the long and short of it is there is a structural problem that we need some structural reforms to be able to help resolve these issues. Now, in terms of the partnerships, based on the private participation I mentioned, you can see that there is a lot of partnerships we are. In fact, let me come to liquid waste. Even for the liquid waste.
It's okay. It's okay. The way you've gone is okay. But I think the point you've made is very clear that there's a big gap. I was wondering, did you guys know this? I never knew this. So, has this always been true? Where is Patrick Apoya? It has been history. Jakora, is it true? Wow. So how come you guys have never advocated for a proper regulator? Where were you doing the advocacy? Me, I've never heard of it. Anyway, but that's why we are here today. Wow, this is powerful. MP, did you know this, that between the ministry at the top and the MMDAs, there's a big gap, a structural gap, and now that you've heard it, what do you think? What are you and your colleagues going to do when you go back to the committees? Honorable Zuwera.
Well, thank you very much. Yeah, there are actually two very big gaps between the ministry and the implementers and the regulator, as he has said, and the source of funding. These are the two major gaps sitting between effective management of our waste. This report, I think, is going to be a template for the Water, Sanitation, and Health Committee. We will take it, we will look through it critically. I have made some observations. One of them is the link between investment and income. Because I've been asking myself, for every waste that a household disposes of, whether they are using the informal approach or the formal approach. They pay for it. I didn't see that component of payment in the research report. So maybe we'll have to take account of that. And then we can zero in on what the levels of investment would necessarily be. We will take it as a committee and use it to foster further collaboration with ESA. You will appreciate that this report covered 2 districts, assemblies, and we have 261. Of course, it provides the snapshot that we get to know at a glance what is happening around our country. But we will have to work deeper and see whether it is representative enough so that the more districts we cover, we can then have I think, a better picture of what the environment and the waste management situation is. So the committee will work very closely with ESA and explore ways of replicating this work in some more districts so that we can provide a better picture. We will also look at a multi-sectoral approach to this. Waste management cannot be just for Ministry of Housing or local government. It's a multi-sectoral activity. We cannot do effective analysis without good data. The data that we use, the fidelity of the data must be assured. And so when my sister mentioned Rwanda, in Rwanda there is no household, not one, that is not captured on the database. And the households pay directly through Momo to the agency that provides the service of waste management. So no one is left out. In Ghana, Prof already mentioned it. One of the difficult things we have in this country is data. How many households do we have? How much waste they are generating? I'm not sure we can tell. We can always do an estimate. So if we have a system where households are properly captured and households are paying for disposal of waste, that will be at least half the path. Because if that payment goes into a fund, that fund cannot then be supported by whatever fund the government will set up so that we can have adequate data management, waste management. Parliament and the Sanitation Committee have been pushing for the restoration of the sanitation levy. I know our committee chairman is very passionate about that. And so we are going to, based on this report, continue to provide that push at the level of Parliament and at the level of policy to ensure that the fund is set up to help us manage waste properly. The heavy lifting aspect of the waste management already is being provided. I think about 90% of this is being done in the private sector. How are we working to bring them into a formal arrangement so that they can be targeted as a unit to work with? I think the Water and Sanitation Committee will look at how best we can help in terms of policy to sanitize this area. And Bernard, let me say, even as I sit here, the gentleman who picks the waste in my house, every day I negotiate payment. On the day that I have money to spare, maybe I don't grabble too much. On the days that I don't have money, I will wait and negotiate till he comes to the barest that I can pay. So we need to formalize these things.
Okay.
We need to know how much are we paying for waste disposal. It will help us in our own waste management efforts. The last thing I want to say, Bernard, is I know Prof touched on it a little bit, the education and the sensitization bit. I think that attitude we need to work on that. We need to work on the attitude of the Ghanaian and how we manage waste. I mean, Rwanda, she mentioned it. Addis Ababa, you can't walk on the street and just litter. You are not allowed to. When you get to Kigali International Airport and you've wrapped your suitcase with that plastic thing that we do, they will make sure that you take it off before you exit the airport. So regulation and governance is also very important. That is where he has come in. So we will be using this report to drive this.
Please work on the sound.
Yeah, we will to drive this initiative so that we can have a holistic.
Thank you very much, Honorable Zuwera. Please put your hands together for her. I'd like to acknowledge a few more MPs who have come in, and we are really heartened by the multi-sectoral committees represented here. So I believe we have the chairperson of the local government committee, Honorable Queensta Poku Asoya, MP for Agona East. Oh, you can say yeah. Thank you. I've also seen Honorable Amprechum, I think he's MP for Mampong. Amprechum, please put your hands together for him, a key member of the committee. I think I've seen MP for, is it Aqua? Yes, Akim Swedru. Achimda, yes, Akwesi Aqua. Please put your hands together for him. He was a former deputy minister. I'm working with my eyes, so forgive me. I'm sure there are more MPs I have not seen. Please forgive me. So we have about 5 committees in terms of all those who have come. So MPs, are you confirming to us that you are committing to a multi-committee effort to address the gap, he says? Because I think the biggest thing we've learned today from the gentleman from local government is that sanitation is the only sector that between policy and MMDA, there's no regulating agency. And I didn't know, I'm sure some people here didn't know, but a lot of them say they know. So there's a strong push in this room for some regulators within that space to regulate what happens and to enforce standards. Some have proposed, for example, a national sanitation authority. MP has also mentioned the need for a fund or some sort of financing to support the sector. Those are the 2 takeaways, Prof, I can take from the discussion so far. If there are any more, hold on please, if there are any more suggestions stakeholders want our MPs to carry to Parliament, please let's say that now. We've asked a lot of questions, but I've never seen a program where a lot of MPs from both sides have come for money and they are waiting. So I really want to advise the sector players, if you have any specific legislative emphasis you want to give to the MPs here, now that we have their attention, I'd like you to raise them now. At least we've mentioned the Sanitation Authority, and we've mentioned the need for a dedicated fund. Or, Mr. Is there any more you want? Because now they are here, they have their pen and paper writing. Please give him a mic.
So, just to seal it, the 2 biggest ask is the regulator. And, dedicated fund. And most importantly, what this will do is that money will now follow performance.
Very good.
And so that is the 3rd part I just wanted to add to that.
All right. Wow. This is amazing. Put your hands together for yourselves. Are there any final comments? Because I'm going to bring Professor Quote back to close us in terms of summarizing the key learnings. So let's do one last round of questions. Yes. Please come for the mics. We'll start with the Fugu middle. Yes, there's a Fugu with a hat. I'll end with you. Yes, I'll end with you. So we'll take the 3 on that table and take the rest. Yes, madam. Yes, madam, please. Yes, sir, you are on.
Thank you. And I recommend research team for a this is not my first time of seeing this. I'm formerly called Joseph Awuye. But now Togbega Gadagbe, Paramount Chief of South Town, Agave Traditional Area. I have been in waste management since 1980.
Wow.
And have witnessed the start of waste management in Ghana. During that time, we have the Metro Public Health Department, who goes to hospitals quarterly to give reports from communicable diseases from the hospital to the waste management department to analyze what we do. But upon the implementation of the polluter pay system, that has died down because the assemblymen set tariffs for collection of the waste, which is so far below the operational cost. And this has rendered most of the service providers unproductive. And when the minister says there is a lot of waste going into the drains, these are some of the costs. Okay. People don't pay the right tariffs for collection. I was just called by the waste management engineer that there is waste at Makola. I operate from Agbogloshi, Okanshi, Katamanto, Makola. Formerly, we collect morning and evening. People don't pay. So I have changed the system to once a week, once a day collection, which is in the night. And even that, people don't pay. We work in the night. People close in the evenings. Who are you going to get to pay you? Yeah. You see, the engineer from the local government ministry said one of the problems is collection of the fees from the polluters.
All right.
So
thank you, Togbe.
Thank you.
We appreciate
I wish the ministry takes this seriously.
Thank you, sir. Madam, and then, sir, please give it to the, yes, next step. Madam, please.
Thank you very much. My name is Basilia Nambigne from Executive Secretary of CONEWAS. So I acknowledge the 2 points that we raised because CONEWAS has started engaging government for a sanitation authority and fund since 2017.
Wow.
And so I'm happy that we have all brought it up again, and
yes.
I know this time it will work. What I would like to add is going down to the district level, we need to empower those who work there. And so most of the environmental health working there are still in units, and they need to be upgraded, just like one of the MPs said. So one ad I would like to also reference again is rising them or making them departments, especially those at the district level, getting them from units to department. I acknowledge that it was one of the calls from this current government to make them departments, and so I'm just bringing that up too, so that they can be capacitated to work well.
Thank you, Madam. Back to the table. Yes, please.
My name is Lydia Banfo, informal waste sector and Nkoso waste management as well.
Okay.
Please, I want to answer, Prof said something that the informal waste sector, they are very difficult to approach. Please, it's not that. Informal waste sector, we are a cooperative.
Okay.
Which some of the MMDAs recognize as, and some of them even giving out contracts to them to operate. I know my honorable boss is here, Ni Aboye, Adenta Municipality. They have given informal waste cooperative a contract which has been signed by the MMDAs. So that means that they have been recognized them. One, they have integrated them into the informal waste sector or the waste management activities in Adenta. The same as Medina also did. Okay. They gave them a contract. Okay. So it means that the informal waste sector, those who are there registered as a cooperative, they are there. All and right. They are very reasonable also to cooperate with them. Because we have been several researchers, we have been working with several researchers across. So please, Prof, we are always available.
All right, I need to announce that we are going off air at 1 o'clock and it's 5 minutes to 1. So I think I'll take one last comment and I want the conclusions to go on air. So please, we have many questions to ask, but we just have 5 minutes. So last question or last comment, then I'll come back to the stage. It's what? It's 5 minutes. It's 5 minutes. It's okay.
Thank you, Wilson Awaite, Divine Unity Company, member of ESPA.
All right.
ESPA people, we have one big issue.
Oh, Lord.
And I believe as our big men are here, they will take it up and do it for us.
Yes, please.
Tax tax. They should waive tax on the trucks that we import.
Waive tax on the trucks?
Yes. Because if they do that for us, we can import more trucks and the trucks will be working.
It's a clear point.
We implement the 24-hour economy, we boom.
Thank you.
Thank you.
Then give it to the former deputy minister, yes.
Yes, Bernard, we were all wondering why there hasn't been that gap filled between the policy and MMDAs. Maybe we should turn our eyes to the fact that for some time now we've had a big private sector player occupying that space. You understand? And so maybe blinded all of us that we needed a public regulator. But that should let us applaud that big time private sector player that had occupied and held the fort all this while.
Thank you so much, sir. I want to yield to the panel, take a comment from Ministry of Local Government, and I'll give Prof the last word to summarize for us. So, sir.
Thank you, Bernard. So, I almost missed this opportunity, but there is the part on enforcement by the MMDAs, which is currently constrained, has constrained the work being done, the enforcement work being done by the MMDAs, to the effect that when perpetrators are arraigned before courts of competent jurisdiction and fines are slapped on them, the fines are wholly paid into the consolidated fund. Pursuant to Article 176 of the 1992 Constitution, the assemblies cannot, or the court cannot even grant the assemblies the authority to pick any proportion of the fines to defray the cost of enforcement. And so the cost of enforcement already has become a disincentive for the MMDAs to embark on rigorous enforcement. And so that is also one of the things contributing to the slow pace of enforcement we are currently seeing at the MMDA level. And so once we have the select committees here, it will be one of the things that, in fact, the Article 167 mandates that it can only be done when an act of parliament authorizes that to be done. And so maybe it could be one of the things that we could add to. Thank you.
Okay, so I noticed Prof is taking notes. He will come and close us. If he misses anything, I may add it. So Prof, you started us with the presentation and you've heard all these comments, and it's like we are arriving on about 3 or 4 big things to take out. I'd like you to give us your closing thoughts and the way forward. Please put your hand up, Professor Peter Korte. Thank you.
Yes, thank you very much. I think it's been a very stimulating program. We started first by saying that we treat waste management, sanitation waste management as a residual. We don't invest in that. It's when all other areas or sectors have been financed before we look at how much we put in them. And so far it looks like we invest about 180 million, and that is about it. We don't invest as much as needed. We've shown what the benefits are if we were to do the business as usual, or if we were to scale up and invest more compared to best practices. And we've seen the evidence that it is proper we consider waste sanitation and waste management as a high-yielding investment, that if we invest in, we're going to minimize cholera, minimize health effects, minimize productivity losses, etc., and as a country, we'll be able to grow. There's been several suggestions and comments. Our honorable MPs and the industry operators and everybody here who have commented have provided very useful information, but I'll provide just 3 or 4 of them. One is the need for a regulator. It is very critical. We've seen that gap and the need to have a regulator, a sanitation regulatory authority. But my suggestion is that we shouldn't just set up an authority that is not going to function. Let's have an authority well thought through that is going to address our needs. It has to be funded. How is it going to be funded? A dedicated fund, but they should also find a way of generating revenue. Every authority should find a way of generating some kind of IGF. So let's push this through. Let's have the structure as well established. And we didn't speak much about willingness to pay. if you look at the industry, people are saying people are not even paying. But whether how much we are charging them is the optimal rate to charge for sanitation and waste. We spoken about the levy. Is that the optimal rate? Is it because it's too high? That's why people are not paying. Why are people not paying? Because they are not getting the benefits from as expected. So there is the need to engage all the players. There is something we call willingness to pay. There is a way of gauging that from customers or consumers. So as part of the way forward, let's engage more. Let's see how we can undertake a further study to find out the willingness to pay, the polluter pay principle, how we can integrate that. Research is very important, and we all admit that we don't invest so much into research. Finally, we are going to disseminate the key findings. All the ideas that have come about, we're going to use that to refine our recommendations, and we're going to disseminate widely the key findings. But we don't end here. We are going to engage you further. I think if we can even have a quarterly or biannual roundtables like this to talk about the sector, it is very important so that we can together be able to address our needs. So on that note, Bernard, I want to thank everybody, the researchers, the honorable members of parliament who have spent all the time with us this period, and everybody present, my colleagues from ISA and other sister organizations, the support staff, and each and every one. Let us support the industry. Public-private partnership is key, just like it's done in other countries. We have private operators here, the big ones, the small ones. Let's fund waste and sanitation management. Let's engage the private sector so that it becomes a win-win situation for all of us. Thank you very much.
Thank you. I think the ISA team led by Professor Koti deserve a big round of applause. Professor Ibo Turkson and the others, Dr. Ajay Mante, fantastic job. There are a few summaries of the report that have been shared, but I'm sure you will put the QR code for scanning the report. You don't even need to print it out. So I don't know if it's a policy brief or more information, but you can scan the QR code or we'll send that to you because you wrote your email addresses. We'd like to say a big thank you as well to EFD Ghana, Prof. Akpalu and your team. Thank you for the support. And also the parliamentary committees. I mean, I've done this work for long. I've never seen a program that you have about 5 committees. Local government committee members, give me a wave. Local government committee, put your hands together for them. Sanitation and Environment and Water Resources Committee, where are they? Give them a round of applause. I think the Science and Technology Committee at some point. There was also Health Committee. Is it Health and Environment? And even Finance was supposed to be. Any Finance Committee members? Yes. So you can see at least 5. I'm sure I've missed some. So Parliament has been strongly represented. I want to say a big thank you to the ESPA and all its, how many? 400 members? How many are you? So all the environmental service providers, association companies, please give us a wave. Let's put our hands together for them. Thank you very much. I'd like to also commend the civil society groups in the wash and environment sector, CONIWAS and all the, where are you? Give me a wave. Civil society groups. They've been shouting about this when there was no money and it was not sexy, before all of us came to join. So Patrick Apoya, the fighter, and all of you, have a good one. There's a strong group of media people who report on the sector. All right, where are the journalists? Where are you? Oh, they've gone. Congratulations on your work as well. 2 final announcements. We will replay this program in the course of the week so that you will see how beautiful and handsome you look on television. That's number 1. Number 2, we have snacks for those who are hungry and lunch as well. You pick a coupon if you want to eat from some of the attendants at the exit, so you can have some lunch and discuss further. We hope that this is not a 9-day wonder. Just like you do State of the Ghanaian Economy Report, if you can also do a 1 year, every year, State of Sanitation or whatever, I'm sure we can find the support to give it airtime. So Issa, please convene us again next year to see the progress made. Hopefully when we come, the Sanitation Authority will be the one sponsoring it. That would be wonderful. I'd like to call Dr. Ralph Amma, where is he, to do a quick closing prayer, and then we'll be on our way out. So, Doc, you have the floor. Thank you.
Let's pray. Lord, we thank you for the privilege to be alive and to participate in this event. We pray that all that we've heard would be implemented successfully. We ask that, Lord, you would open the way for us for things to be better than they are now. We thank you and honor you in Jesus' name. Amen.
So thank you very much. We'll see you next time. Bye-bye.